Hello, my name is Claisse and I'm going to present on behalf of my research team a paper entitled Investigating Daily Practices of Self-Care to Inform the Design of Supportive Health Technologies for Living and Aging Well with HIV. This research is part of a UK Research Council-funded project called Intuit, which is an interdisciplinary collaboration between 6 UK universities and a number of partnering organizations. Intuit aimed to understand the potential value and barriers for sharing personal health data when living with potentially stigmatizing long-term conditions like HIV. Our paper reports on the design, deployment and discussion of a research through design study with a self-care diary. We designed the self-care diary to establish a context for research dialogue and reflection with intended end user taking part in the study. The diary was used as a critical vehicle for empirically investigating daily practices of self-care with individual members of the research population, and for understanding how self-reporting on health and well-being may better support HIV self-management and communication with healthcare professionals and others within relationships of care. Each bespoke diary was presented in a folder personalized with participants' name. In total, 7 participants took part in the study, which was 12 months in duration. We designed a page-a-day diary that included daily and weekly prompts. On a daily basis, participants were invited to capture information about the daily well-being in a visual way through coloring in pictorial trackers. They were also encouraged to reflect on how they were feeling during their day through handwriting or doodling. Weekly prompts and crafted materials were also inserted to encourage self-care activities and to break with the routine of the daily prompts. We felt that the diary method was appropriate to understand situated and mundane activities and experience of our research population over time. Our methodological aim was for the self-care diary to motivate participants to sustain their engagement over time and understand valued design features of the diary to support self-reporting on experience. The diary study was informed by recent calls in HCI to study self-care practices so that future digital health tools are better grounded in lived experiences of managing long-term conditions. Nunes and colleagues highlighted the need to reorient the focus of self-care technologies on mundane self-care over medically oriented self-care in order to design for the practical work of patients and others in their networks of care. And critical to this is how researchers can use insights from fieldwork and design skills to generate consideration for design that truly reflect the reality of people's lives. The study of self-care with HIV remains largely unreported and arguably under-supported in the HCI field. To date, everyday care needs, including psychosocial and emotional needs, remain unmet by current tools and services, as most interventions for HIV have focused on medication adherence, reinforcing a medical narrative. Previous research has also reviewed existing apps and reported poor communication design, including brand identity and choice of language. Such designs have arguably reinforced stigma. In our paper, we report on the development of the diary and offer design implications from a critical digital health perspective. Through engagement with the diary, we found self-reporting practices valuable to people living with HIV, for fostering bodily awareness and self-efficacy, for supporting the non-trivial task of balancing emotional well-being, and thirdly, for sustaining long-term care management and quality of life. For the purpose of this brief presentation, we selected 3 considerations, and we encourage you to read our paper for more details. Our participants described the importance of listening closely to their body and how through time they become sensitized to symptoms and signs of ill health. This included developing their own strategies for health management. So here, as HCI researchers, we ask, how may self-care tools be designed to help users develop bodily awareness, and how could this be enhanced by sensory triggers? Participants talked about the therapeutic aspect of using something like the diary to make sense of their health and well-being. However, they were concerned about translating this into a digital tool like an app. For example, one questioned if a digital tools would afford the same kind of intimate, private and personal interaction. So there is a space for considering the appropriateness of non-digital elements in self-care service structures, and how could these accommodate for tangible or hybrid interaction with digital and low-tech elements. Finally, insights from the diary study highlighted potential value of self-reported information for whole-person care. Participants also described the value of capturing information and documenting changes, not necessarily for presenting or sharing that information with the doctors, but rather as a way to come to those conclusions by themselves. This was described as empowering. For example, self-reporting was seen as a way to increase confidence in the communication with healthcare professionals. So here we ask, how could service users be better supported in organizing self-captured information? What functionalities could help with synthesizing or condensing captured information ahead of a consultation? In our paper, we also report on participants' trust, security, and privacy concerns for self-reporting about their health digitally and online. These concerns are not new, but they've been amplified by the COVID-19 pandemic. We feel it is important to reflect on our findings in this context for different reasons. First, there is a burden and fatigue that comes with digital monitoring and remote communication. Then, telehealth and remote services have exacerbated health inequalities and challenged accessibility of care. This was reported by some of our participants who shared not having enough data or lacking of digital literacy. With this in mind, we further raise an opportunity for considering how low-tech or no-tech solutions may be developed to sit alongside digital tools and services for supporting individuals. Finally, with our finding, we contributed to a growing body of work that raised the importance for health technology to give primacy to people's mundane activities for whole-person care and improving quality of life. We hope that our insights can provide materials for designing self-care technologies that better support the mundane and psychosocial dimensions of living and aging with long-term conditions like HIV. Thank you for listening, and please don't hesitate to get in touch with us.